Okay, we're now to the point where we've pretty much eliminated all PSCP interferences, or for those of you who want to use centric reagent CR interferences, we've pretty much done all that now. So what we're going to work at now is getting rid of posterior excursive interferences. Now again, our real concern is we'd like to eliminate all interferences that are in the way of the envelope of function. In reality, it's kind of hard to know exactly where her envelope of function is in the posterior teeth when we talk about it three-dimensionally, as far as the anterior, posterior, and laterally. And we can try that, but we find is if we eliminate all posterior interferences to all excursive movements, we know that within doing that, we are going to have eliminated all of her envelope of function interferences. So that's exactly what we're going to do. Okay, if we eliminate, if we have you in your seated condylar position, and we eliminate all excursive movements out of that position, wherever your envelope of function is, we've got it. Okay, because we're at the border. We're at the border of the movements of your mandible. Okay, and so in doing what we're going to be doing here, we may be doing something a little additional that maybe wasn't necessary, but we know we're getting everything we need. Okay. And so what we can now take your appliance out. And I know you're going to miss it. I know you're going to miss it, but we're going to take it out there now. And just go ahead and tap your teeth together here now. And I like you to kind of listen to the sound. Tap, tap. Very classic. It's not a thunk, thunk, thunk. It's a very sharp click, click, click sound. The sound is very diagnostic. And we're not 100% there yet, but Debbie, how does it feel right at this point even?
Feels very nice. Yeah.
Do you have any awareness of any one spot? Does it feel?
No.
Okay.
Even.
Yeah, we're probably pretty close there. So let's practice a little bit here, Debbie. What we're going to do is what I want you to do is close down. Now just very lightly slide your teeth to the right until stop right there. Okay, beautiful. Right now we're basically end to end on the canines. Now what I want you to do is to squeeze back. There you go, with pressure. So very lightly to the left, squeeze back, forward, and squeeze back. And that's what I want you to do, okay? And that'll work out very nicely. Okay. And typically I do one side at a time. And Donna, let's go with some isolation here again. Very good. And we're going to use red silk. I like to use for excursive. In fact, let's go ahead and clean them off first. Let me have again a cotton. There you go. Let's kind of erase everything here. Then go ahead and just kind of squeeze. You're not grind around. Good. Good. Kind of like erasing the chalkboard. Open. Good. And isolate either side. Either side. And I like to use for doing excursive movements, I like to use silk. Silk's a little thicker. I think it's in the range of about 60 microns. And I like the silk for that reason. It's going to be getting any excursive movements and then some. A little bit of a fudge factor there. Okay, I'll take the black. You can have the red. Okay, what I'd like you to do here is slide to the left, squeeze back. Slide to the right. Squeeze back, slide forward, squeeze back. Let's kind of grind around, grind away, and just like chew and grind. And you're off on the anterior there. Reposition that. Good. Go ahead. Chew a little bit. Okay, open. Now, go ahead and chop, 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 chop. Open. Good. Now we'll see here. We have red and black marks. And anything on the posterior teeth that is not covered with red, we know is an excursive movement. And also excursive interference. And also what I can do at this time, I know my contacts are pretty even intensity, but I can go in and even reshape my centric stops here, or my PSCP stops, whichever name you want to give them. And again, in doing what I'm doing here, eliminating all the red marks, I know that in the process of that, by doing that, I'm also eliminating any potential envelope of function interferences.
Okay, another cotton roll down the door for the fun. Good, thank you.
Okay, red. Right down, slide to the right. That's okay. Other right this time. Squeeze back, left, squeeze back, forward, squeeze back, and grind. And cut this one off. Go ahead and chop, 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 chop. Open. Look at that cotton out there, Donna. I think we're not even going to use that. Seems to be fighting us more than helping us here. Now again, adjusting this buckle cusp on number 12 here, if I were doing anything significant as far as lengthening number 11, I would be concerned with whether or not I really need to do this. But we don't know what we're going to do with that, and my amount of adjusting here is really pretty minimal. So I'm just going to go ahead there and wipe it out. And again, I'm using right now, just for your memory again here, I'm using just a white stone. So the amount of adjusting I'm doing here, it kind of reduces and polishes almost at the same time. Okay, right down, slide to the right, squeeze back, left, squeeze back, forward, squeeze back and grind. Good. And black again, please, thank you. And chuck, 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 chuck. Open. Debbie, is that sensitive at all? And then that one tooth number 19 there that we're going to be restoring. Is that you doing okay though? Okay. Slide down, slide to the right, slide left, forward, back. You kind of grind for me now again. Open. And chuck, chuck, chuck. Open. Good. One disadvantage of using the white stone is even though it leaves a real smooth, nice polish, it does generate a little bit of heat. And you got to be careful not to put any pressure on, because you can create some heat with this. Okay, one more time. Let's be close there. Okay, close, Eddie. Slide to the right. Squeeze back, left. Squeeze back firmly. Forward. Squeeze back, grind. Open. And chop, chop, chop. Open. Good. Okay, that looks good. We're going to clean these off later on, and I'm going to have you, Carrie, come back in a little later and show what this looks like, okay? We'll catch, we'll make it the right side done, so this looks real nice here. A little bit of an incline here, yeah. Okay. That's the way. Is it okay there? I know that one's a little sensitive, that one that has that big, that big enamel defect in it. Yeah, let's try this time again. Seems like it looks better on the right than the left.
Yes, it does.
Okay, Debbie, you got fresh soap there?
Yes.
Okay, Debbie, bite down, slide to the right, squeeze back left, squeeze back forward, squeeze back, grind. And open. And Debbie, go ahead and chop, 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 chop. Open. Okay, we don't have nearly the experiences here on this side. Okay, mark red. Right down, Debbie. Go right, you know, the whole routine here. And grind real good. Grind real good there. Open. Chop real hard. Open. Good. Good. Bite down, slide to the right, squeeze back left, squeeze back forward, squeeze back and grind. Open. Open here. And chop, chop, chop. Open, good. me get that piece of cotton coming down. Just remove that. Thank you. Does that sensitive at all? A little bit? Yeah. These white stones again, that's the one downside. Anyway, we're little piece. Okay. Donna, let me clean this plate here. And I want to go now to, let's go with some red film. Remember, when we're doing with the red silk, right down, sorry, real quick. Open. We're going to get a little more marking than what we're really getting. So let's check it with the red film now. Right, red pressure, black tooth. We'll mark it. I think we're pretty much there. Let me go ahead, slide to the right, squeeze back left, squeeze back forward, squeeze back grind, and open. Thank you. Open. Chop, 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 chop. Open. Good. Okay, we're going to leave that right there. Let me erase the other side. I'm going to want you pretty soon, Terry, to get a look at this here. Right down, grind real good. Clean them off. Open. Grind again. Open. Open. And let's go with the red. The red film. Right down here. Slide to the right. Squeeze back, left, squeeze back, forward, grind all around. Open. And nice and firm. Chuck, chuck, chuck. Open. Good. Okay. I think this would be a good point if you could take the camera off there, Terry. Okay. Let's take a look at this. Okay, so here we have, we've marked now, we've got our posterior excursive interferences pretty much taken care of here. Back of the mirror, maybe this will help show a little better here, where we actually have contact. Okay, open here. As you can see, we have nice contacts on the upper, on the cusp tip, so numbers 2, well you can see we have nice contacts around, and absolutely no red interferences at all, no red or excursive interferences. We have contact, as you can see, on number 11 here. We don't have on number 6. At least we didn't mark it on number 6. We'll check that again. When it's as close as it appears to be, I have a decision to make as to whether or not I want to add on to that restoratively, which we anticipated we might need to, or if we're going to give it a chance a week or two, and a lot of times we'll find that it'll erupt right into contact, and we'll take a look and see how close it really is. But that looks pretty nice. That looks pretty good. And at this point in time, we're going to be ready to go in and check the anterior, the envelope of function, and make sure that the envelope of function is coordinated to the anterior guidance.